Hi, my name's Ron Vender, and I'm a dermatologist in Hamilton, Ontario, Canada, and I'm here to talk to you about a Take 10 video for IPC, and I want to thank IPC for allowing me to do this with you and for you. I'm going to talk a little bit about a happy life and a happy office, and we know that that doesn't always rhyme, but I think it's important that that we take time for ourselves, for our mental health, and for our physical health as well. We're all high achievers as dermatologists or even rheumatologists and other physicians, but all physicians are high achievers. Dermatologists tend to have a type A personality, very attention to detail and so forth. But I think it's important to manage our office in a way that we can handle things. So first of all, we have this pressure of a waiting room and people waiting in the waiting room. And I've been able to eliminate that. That relieves a lot of pressure on me and on my staff, makes a happier staff and a happier patient as well. I book my patients at a time slot that seems to be convenient for me, that you'll have to determine. If you find that a 5-minute, 10-minute, or 15-minute time slot is not enough for you to properly take care of these patients, give the assessments and explain things, if you don't, especially if you don't have any ancillary health staff, and then I think that it's important that you change your schedule, and you have to do that gradually. You need to put the slots for your appointments that match the way you practice, and you have to force yourself to do that, unless you want to run a stressful practice all the time, but this is not what this talk's about. Another thing that you should do is you need some breathing time. And so what I do is my clinic starts at 8 in the morning and goes till 12 noon. And at 9 a.m. and at 10 a.m., I leave a whole open slot just for what I call office work, breathing time, maybe calling somebody, maybe just having a coffee. I think that we need to have that time. Now, you may say doing all these adjustments will increase your waiting list. Well, if that's what it is, then that's what it happens to be. You can also add slots at, let's say, half of the hour, for example, 9:30 and 10:30 in the morning, or 1:30 and 2:30 in the afternoon for emergencies. That if somebody calls you, a colleague calls you, or a patient calls and needs to be seen, you have a place to put them. And if it doesn't fill the spot, then it doesn't fill the spot. Then you have time to maybe read an article, answer some emails, or just call your spouse at home. You need to have some breathing time. In my office, I also play music that I like. It depends on my mood and what I feel like, what kind of music, but playing this type of music sort of distracts me from the buzz and noise of staff and everything. At times, I'll lock my office door and stay in the office and tell my staff I don't want to be disturbed for 10 minutes, maybe when I'm talking to family at home or on a personal call. I just can't be bothered, and I press do not disturb on the phone. Another time-saving thing is maybe when you're driving home and yeah, the office is done, but that's a time where you don't have any external stimulants except for the traffic, is a time to use your Bluetooth and call people, call your friends and see how their day was, call your spouse and your family and see how their day was, call a store for maybe something that you're looking for and speak to them, or just a time to have that alone time in the car without any external distractions except for traffic, and drive carefully. So that is another idea that you can have. When I come home, I tend to go on walks with my spouse, and we go hiking. We may just walk around the town, even for half an hour, just to clear my head. And I make the time to do that. And then we have dinner together as well. So what happens after work if I have to go to a meeting? What happens if I'm running late? I don't run late because I have the correct amount of time. And what happens if I have a meeting after? Well, if I have a meeting after, then I'm not able to do the walk. But I do set time in the week as a reserve time, as a time where I am not going to accept a meeting. You just have to say, no, I'm sorry. This day is not available for me. This is my family day. And staff and pharmaceutical companies and sponsors will understand this as well. I don't go to the gym very much, as you can probably tell. I find that it's becomes another noisy space and so forth. But sometimes walking alone is good, even running is good. But if you enjoy the gym, you must take the time to do that. I think that you'll have a better sleep. I think that you'll feel better overall if you manage and don't push your schedule and your practice to run at 150%. There's absolutely no need for this at all. You need time for mental health. You need time for breaks. So in summary, set some special times in your office for office work or for catch up or for urgence or for both. Make sure that your appointment times are long enough. Don't double book. I will not double book. Don't double book. It's a bad habit, and it's not good for the patients. Try and run time as much as you can. Take at least a half an hour for lunch at a set time every single day. And finish early. Sometimes it's good to finish early as well. You don't have to work till 5 or 6 or 7 o'clock at night. I know we're all busy and we're in demand, but sometimes we just have to learn to say no. We have to learn that our mental health and our physical health is more important than anything, because without that, our patients will suffer and our families will suffer as well. So with that, I just wanted to give you my thoughts on trying to run a stress-free or less stressful type of practice, but we have to force ourselves to do this. We have to give our time and our mind time to relax in this very, very busy, fast-paced world. So with that, from Canada, I'm Ron Vender, a dermatologist for over 32 years, and I want to wish you a good day, a good morning, or a good evening, wherever you may be listening from. Take care.